Dear healthcare professionals and my dear viewers, welcome to Healthcare Engineering channel. I'm R. Surya alias Kritika, a biomedical engineer from Healthcare Engineering team. I'm so glad that our team have an opportunity to have a presentation like this, and I always like to share the knowledge and experiences what I gain from the industry with you all, and this makes me and our team to create such an amazing and knowledgeable presentations like this. I strongly believe that all kinds of healthcare professionals and students can learn a lot from our channel and blog to update their knowledge by knowing the trendings in modern healthcare world. Therefore, I would like to welcome you all to subscribe our YouTube channel and press the bell icon to get the notification instantly once we post our informative video. And also you can visit our blog www.learnbiomedengine.blogspot.com. You learn more on the concepts we share in our videos. We can advertise your healthcare products, we can promote your healthcare events, we provide supports to boost up your healthcare business, we can provide technical reviews for your medical devices and many more online supports. If you are interested to get the support from us, please contact us to our email ID which will be shown in your screen. Healthcare engineering team also active in these social media platform. If you want to get more updates regarding healthcare, you can follow any one of the platform or all of these. And also if you are healthcare professional who wanted to give information regarding healthcare sector, you can utilize our WhatsApp group to share your thoughts. All the blog links and also the social media platform links are given below in the description box. Today, in our presentation, we are going to see a topic which is nothing but virtual colonoscopy. What is virtual colonoscopy? CT colonoscopy or virtual colonoscopy is a medical imaging procedure which uses X-rays and computer to produce 2 and 3 dimensional image of a colon. It includes images of the large intestine, small intestine and colon. CT colonoscopy is mainly used to evaluate collateral polyp detection and it may be used for collateral screening. If your doctor is concerned about the quality of the view through the scope, he or she may recommend a repeat colonoscopy. If your doctor wasn't able to advance the scope through your entire colon, virtual or CT colonoscopy is recommended to examine the rest of your colon. This is about what is virtual colonoscopy. So these are the images that taken during virtual colonoscopy. This is a normal virtual or 2D and also a 3D virtual colonoscopy. Next, we are going to see about the preparation needed before the procedure. The patient should wear a comfortable loose clothing to your examination. They given a gown to wear before the procedure. If suppose the pregnant woman have an examination, they inform to the CT technician so that they see the safety precaution before the procedure. Bowel cleaning procedure is same as that of colonoscopy or is consist of same cleansing liquid. It is very important to take a liquid diet before the procedure, and also it is very important to clean your colon the night before their colonoscopy. The patient will ask to take any laxative or pills. Some common preparation is magnesium citrate, etc. Additional liquids such as barium and ionized liquids are taken before the examination. If the patient has any health issues such as heart, liver or kidney disease, clearly inform your concerned doctor so that the bowel preparation will be safe in some condition. The patient will consume and start resume their own normal diet after the procedure. These are the preparation needed before the procedure of virtual colonoscopy. Next, we are going to discuss about the virtual colonoscopy procedure. The patient is asked to lie on their left side on the narrow table that is connected to a CT scan machine. Knees will be up towards the chest. A small flexible thin tube will be inserted into the rectum. Air can be pumped through the tube to make a colon inflate and make the colon for better viewing. After this is done, the patient will be asked to lie in the supine position. The table moves through the scanner to produce a series of 2-dimensional cross sections along the length of the colon. A computer program put these images together to create 3D pictures that can be viewed on the monitor. To avoid distortion on the images, the patient is asked to hold their breath for few seconds. The scan is then repeated with the patient lying in prone position. After examination, the images produced by the scanner must be processed into 3D image. The patient may resume normal activity after the procedure. There is no post-procedure problem. These are the procedure that taken during virtual colonoscopy. This is the image of supine and prone position. Next, we are going to see about the difference between virtual colonoscopy and normal colonoscopy. Virtual colonoscopy is less invasive and faster to perform than a traditional colonoscopy and does not require conscious sedation. In traditional colonoscopy, no radiation is required. A low dose of radiation is required in virtual colonoscopy. Virtual colonoscopy is not accurate as traditional in finding flat cancers. Virtual colonoscopy cannot remove polyps. The entire colon is screened in traditional colonoscopy. In virtual colonoscopy, entire colon is screened and also it detects other issues in your abdomen. Traditional colonoscopy requires 45 to 60 minutes, whereas virtual colonoscopy requires only 15 minutes. 5 to 6 feet tubing is required for traditional colonoscopy, whereas in virtual colonoscopy, 2 to 3 inch probe is enough. These are the main difference between virtual colonoscopy and normal colonoscopy. Next, we are going to see about the benefits of virtual colonoscopy. CT colonoscopy provides clearer and more detailed images than a conventional barium enema X-ray examination. CT colonoscopy is less costly than normal colonoscopy. No radiation remains in a patient body after a CT examination. CT colonoscopy is well tolerated, sedation and pain relievers are not needed, so there is no recovery period and you can return to your normal daily activities immediately after test. CT minimally invasive test provides both 2D and 3D images that can create many polyps and other lesions as clearly when they are directly seen by conventional colonoscopy. These are the benefits of virtual colonoscopy. Risk in virtual colonoscopy. There is a very precise risk that inflating the colon with air could injure or perforate the bowel. This mostly occurs 1 in 10,000 patients. There is always a slight chance of cancer from excessive exposure to radiation. However, the benefit of an accurate diagnosis far outweighs the risk. The effective radiation dose for this procedure varies. CT scanning is generally not recommended for pregnant women unless medically necessary because of the potential risk to the unborn baby. These are the major risks in virtual colonoscopy. Limitations of CT colonoscopy. A person who is very large may not fit into the opening of the conventional CT scanner or may be over the weight limit. CT colonoscopy is strictly a diagnostic procedure. If any polyps are found, they will be removed by conventional colonoscopy. CT colonoscopy may not differentiate stool from other artifacts and also small polyps. Colonoscopy is good only at detecting colorectal cancer found on the left side of the colon. Why? Because the left side of the colon is sort of mushroom shaped with a stem, thus making them easier to see and remove, whereas right side often has squattier looking that it looks flatter and harder to see. CT colonoscopy is not recommended for the patient having inflammation, bowel disease because of the increased risk of perforation. These are the limitations of CT colonoscopy. Sterilization and cleaning procedure of colonoscopy. A study done for the last few years by Canadian researchers discovered that up to 15% of the scopes at some centers contain biodirt, which are cells and debris from prior exams. This biodirt can produce harmful microorganisms. There are several phases of cleaning process. First, the technician wipes and flushes the colonoscope with a cleaning solution that is meant to get rid of biodirt. The colonoscope is then cleaned with metrzyme, which is an enzymatic solution designed to break down and remove all debris. During this procedure, a technician uses long specialized brushes to clean in all the ports and buttons as well. The colonoscope is put into the machine and all the required tubes that wash the port are connected. Then wash them with the combination of acidic disinfectant. At last, it is flushed with 70% of isopropyl alcohol. This process takes over half an hour per scope. This is about the sterilization and cleaning procedure of colonoscopy. Next, we are going to see about the maintenance. The maintenance the colonoscope is important. However, this will be carried out by medical staff, clinical engineer, technician, a biomedical engineer and central processing technician for cleaning and disinfecting. Troubles arise during colonoscopy. Difficulties causes during colonoscopy is that trouble in getting through the entire colon or fail to do. So there are many reasons for that to causes the troubles. One such is the presence of surgical adhesions. Another factor is body habitus. Women are likely to have difficult colonoscopy because it has shown that they have longer colons than men packed into a smaller abdominal cavity, resulting in many twists and turns in the colon. Younger the person, more the pain will be experienced. During the colonoscopy, difficulty occur in the sigmoid colon where it can be difficult to get around the acute bends. The most common technical problem is that insertion of the scope. Based on the shape of the colon, each anatomical part has its own characteristic feature and shape, fixation and suspension. These are the troubles arise during colonoscopy. How to troubleshoot this problem? The patient in whom it is difficult to get through the sigmoid colon, it may be worthwhile for the colonoscopist to use a pediatric colonoscope, and also we can use gastroscope, which due to very short radius of curvature can easily negotiate the acute bends. The successful colonoscopy is to make and keep the sigmoid colon straight during and after the scope reaches the descending colon. Before using colonoscope, calibration is must, whether the cable is damaged or check any discontinuities occurred, thereby reduce the troubles while during the colonoscope. These are the problems and also these are the troubleshooting methods for their problem arises during colonoscopy procedure. This is about today's presentation. Hope you can get some clear overview about visual colonoscopy and its process. If you want to know more contents regarding this visual colonoscopy and related to this, kindly visit our blog www.learnbiomedengine.blogspot.com, and if you want to support for your healthcare business, please approach us in the below mail ID. If you like to receive an update of a new video, please subscribe our YouTube channel and also comment your favorite topic or medical devices you can willing to learn. You can follow us in these social media sites to receive updates of healthcare engineering team. Thank you so much for watching.